Dr. Paul Coley, who is our medical expert here at WCNC Charlotte. She and I discussed a number of things really about GLP-1 medications. Obviously, it's not just a fad. Folks are using GLP-1s for a number of different situations, most notably for diabetes and for weight loss. So we discussed more so the weight loss implications, what these medications can offer, and why folks are taking them. So listen in now. Awesome. As usual, I'll have you say and spell your first and last name and your title.
Dr. Payal Kohli, Payal Kohli, WCNC medical expert and associate adjunct professor in cardiology at Duke University and Johns Hopkins University.
Fantastic. Dr. Coley, GLP-1 medications are all the rage nowadays. In fact, my wife and some of her friends are on, can't remember the one. It's not Wegovy or the normal popular ones. But anyway, I know that a lot of folks are using it for different reasons. My mom's on it for diabetes. Let's talk about GLP-1 in terms of weight loss. So it seems like this is this new thing. And in terms of your expertise, what type of things do you want to let folks know about this, whether it's good or bad?
So, as a cardiologist and internal medicine physician, for the longest time, we had weight loss medicines that whipped the organs and were bad for us. They helped to lose the weight, but they did it at the expense of protecting our organs. Now, for time ever, I'm so excited because we have these GLP-1 receptor agonists, which are a class of medications that don't just get the weight off, they actually protect the organs. And so this class of medicines, of course, has an indication for people with diabetes. It has an indication for people with chronic kidney disease. It also has an indication for people with heart disease without diabetes because it protects the heart as well, reduces your risk of having another heart attack or stroke. So I'm extremely excited about this class of medicines. And the way that it works is that it mimics one of our naturally occurring hormones called the incretin hormones, which regulate our appetite and the way that the stomach empties into the intestines. So it delays the emptying of the stomach into the intestines. That changes how our body responds to insulin and sugar. It also gets into our brain and changes our reward signal from food. So for those people that have food noise or food addiction, it can actually help with that tremendously. It can also just help with appetite regulation in general, help you feel fuller faster because your stomach's not emptied. So a really great class of medications that I think has changed the way we think about medicine and cardiovascular disease and cardiometabolic disease.
Now, I know that these, when people are prescribed for them, right, and they're on them, there's I wouldn't say a long period of time because everybody is different, but it doesn't sound like these are forever medications, and maybe they are. Please correct me if so. And then I guess the second part of that question would be, how long after stopping is there an initial issue of weight coming back on? I mean, there's been some talk about that. So can we talk about both of those?
Yeah, so for some patients, there are forever medicines. In fact, they were designed that way. So if you're a diabetic who's taking it for your diabetes, it is a forever medicine because the goal of the medicine is to protect your kidneys and protect your heart and protect your organs and reduce your risk of cardiovascular complications from the diabetes. So if you stop it, you only get benefit while you're on it, not so on and so forth. For obesity, it's a little bit of a gray zone there because obviously the companies, for their own benefit and because obesity is kind of a chronic disease, have designed the medicine so that you stay on it forever because your thermostat, your obesity thermostat is turned up. And so the minute you stop the medicine, the idea is your thermostat will go back to where it was before and you'll put that weight back on. What physicians have been doing sort of anecdotally, and there's been some published data as well, is trying to see if there's some subset of people who are being treated for obesity who can come off of these medicines and continue to maintain the weight loss. And in fact, what you see is that if you stop these medicines, you'll gain about 2/3 of the weight back, not necessarily all of it, but that's an average. So there are some people on this end of the spectrum that will keep the weight off because of the behavioral changes that they've incorporated. And then there's some people on the other end that will gain all of it back. But on average, you gain back about 2/3 of the weight that you had lost. But it is becoming increasingly popular to either lower the dose of the medicine that you're on long-term or trial you off of it and see how you do.
Okay. Now, is there any way that folks can limit weight regain? And let's say they are just done with the medicine. They don't necessarily want to use it for specifically obesity. Is there any way that they can help try to limit that regain of weight at all?
Yes, and I would say even if you're on the medicine, you should be doing these things. So food is really important, what types of food you eat. And I think there is a recipe for how you can limit weight regain or just, limit weight in general. The first is you want to eat really protein-rich meals. So protein has the same sort of effect on our gut. It makes us feel fuller faster. So I would say 20 to 30 grams per meal in your protein if you can add that. The second is a trend on social media that I'm a huge fan of, which is called fiber maxing, where you want to maximize the amount of fiber in every meal that you eat as well, because fiber has the same effect. It keeps you fuller faster. It also changes the bacteria that lives in your gut so that you have sort of a healthy balance. And it helps you, kind of regulate your weight as well. It regulates your blood sugar. So that's a really important way to do it. The third is what's called volume eating. You want to try to eat foods that are not as calorie dense. So, lighter foods like salads and such, so that you're not eating more calorie dense food. So it's not just about the total calorie intake, it's about the density of calories that you're eating that matters as well. Then finally, I would say for every one of us, you should stick to a schedule when you eat, because what really gets us is that grazing and that snacking in between the meals. That's where a lot of those empty calories come from, as well as those liquids. We drink a lot of our calories and we don't realize that we do that. So sticking to your 3 meals a day, one snack in the middle if you want, that's really important as well. Then of course the exercise. So for most of us, I would recommend 150 minutes, which is 30 minutes, 5 days a week. But if you're trying to lose weight, you want to double that to about 300 minutes, which is, an hour, about 5 days a week of moderate intensity exercise.
Okay. That kind of brings me to my next question, Dr. Coley, which is, these medicines, as you said, are built for forever standards. Are there any drawbacks in some sense? And I ask personally because I've seen with my wife, and she's kind of noted that with the weight loss, if she's not in the gym, there seems to be a muscle loss to this. Now, aside from that, and debunk that, please, if that's not true. Are there any other negatives that doctors are seeing or that people should be aware of? I know that it goes case by case basis, I'm sure, but anything that comes to mind there?
So, there are a lot of things, and this is why I don't want us to think about this as a diet fad. I don't want us to get this from med spas or compounded things, because this is not a beauty treatment. This is a medical treatment for people whose obesity is a threat to their life, for people whose obesity is going to increase their risk of cancer, heart disease, dementia, stroke, what have you. That's who this is appropriate for. So there are some drawbacks. As a physician, one thing I always ask my patients is whether they've had medullary thyroid cancer, because in animal models, this actually caused a dose-dependent increase in that specific type of thyroid cancer. We also ask people if they've had something called pancreatitis, which is inflammation of the pancreas, which is one of our GI organs, because this can increase the risk of that as well. As you alluded to, muscle loss and bone density loss is something we've noticed, especially in our older patient population that tends to take this. And there's two reasons for that. One is obviously when you're losing weight, you have less meat on your bones, so your bone density goes down, but the medication does reduce muscle mass independently as well. Now, thankfully, it reduces fat mass by about 3 times as much as it reduces muscle mass. But you really need to actively work on maintaining your muscle mass. Also need to see where you started in order to ensure that you don't end up losing too much muscle mass. If you lose weight too quickly, your body goes into a breakdown state. You can start to lose your hair. You can start to have saggy skin. You can start to have a lot of other changes associated with rapid weight loss, including changes in the amount of other medications that you need and such. So I don't use this medicine lightly. I think it's a great medicine for those patients in which obesity is a threat to their life. We know that 40% of American adults are obese, 20% of our adolescents are obese. So those are the people that need it. But when it comes to using it for recreational weight loss or turning up and down the volume on it whenever you want to drop a few pounds, that's not how it's designed.
Okay. Now, are there any negative health impacts with just stopping and starting that we know of as well? Because I know that, as you said, I think a lot of folks are maybe they have, in some sense, I've heard people talk like, hey, I have like maybe 30 pounds to lose, right? That may not be a smart decision. Can I say that?
I would agree, because I don't
Okay.
think you can jerk your body around, right?
Okay.
So a healthy weight loss is no more than 1 pound a week, and that's already on the high end when you're
Okay.
on the medication. You don't want to be using this medicine because you have a wedding coming up, you want to drop some weight, because the medicine, once it gets out of your body, especially if you're on a higher dose, you almost have to go back to the beginning in order to
Mm,
get body kind of used to it again, because we have seen people who have taken compounded forms or taken more than they're supposed to take end up in the ER with stomach paralysis, because if it's slowing down your stomach from emptying and you give yourself a big dose and your body's not ready for it, then you might end up having toxicity from the medication. There's not a reversal for the medicine, and it is an injection. So once it gets inside your body, you got to wait out. It takes about 2 weeks to start to get to a pretty low level, then really about 2 months to completely get out of your body. So you have to wait that out if that were to happen. So don't just turn it on and off when you need it. Definitely be in consultation with a medical professional, not someone from a med spa or compounded stuff that you're getting off the internet. Make sure that it's a physician that you talk to and trust when you start this.
Love that. Perfect. Dr. Coley, anything else that I'm missing that you wanted to highlight about this? I know there's a ton of things we could talk about, but what comes to mind for you?
I would say that, we're still on our journey with the weight loss medicines. We're evolving it. So the first round had Batman, that's called the GLPs. The second round has Batman and Robin, that's the GLPs, GIPs, which are turning out to be even more effective than just the GLPs in terms of weight loss. And on the horizon, we have Batman, Robin, and Batwoman coming, because we have GLPs, GIPs, and glucagon. That's called a triple agonist. So I think it's still evolving. I think there are other types of weight loss medicines that I'm not a fan of as a cardiologist that, whip your heart, they amp up your metabolism, they get the weight off, but they don't have long-term effects. So all weight loss medicines are not created equal. And they are working on oral forms of this medicine, but those don't work nearly as well because of the way that they're absorbed in the stomach. So you need a much higher dose and the absorption doesn't get there. So for now, we really have these once weekly injections. Use them responsibly. Talk to your doctor. If your BMI is over 27, you're probably a candidate for this medication. So talk to your doctor about whether it makes sense to start it.
All right, Dr. Coley, I'm going to stop this. I appreciate you.
Great. Did we cover everything?
All right, it's great to have Dr. Coley every Friday at 7 o'clock here on WCNC Plus, talking about the health headlines that matter to you. So we ask you to download WCNC Plus to get that information in the palm of your hand.